Hello, my name is Cecilia Landa-Avila. I'm a PhD researcher at Loughborough University. Today, I am going to present you a critical reflection about participation in healthcare systems design.
This presentation has 4 sections. In the first one is the introduction, then the methodology. In the third one, I will present you 5 challenges and recommendations for participation in healthcare. And finally, some conclusions. So first, I want to mention my personal motivation, as this critical reflection is based in my whole PhD journey. And the first one is the experiences lived by my parents during their long-term condition journeys. Then is the frustration about the power dynamics between patients and healthcare providers. And finally, a desire to trigger a positive change there. This research recognizes that healthcare is a complex system because there are multiple elements interacting, such as the environment, technology, tools, processes, and tasks. But one of these elements is people. In healthcare, there are multiple stakeholders working together to achieve the same purpose, and this looks very easy and straightforward. However, it may be that each of these stakeholders has different views about uh, how we can achieve this purpose. And this is because these different views are influenced by the diversity of needs, behaviors, and values. So we need to be aware and embrace this diversity and integrate it as part of the design of healthcare systems. Do we need participatory approaches in healthcare? Well, the short answer is yes. There is evidence there telling us that participatory approaches help us to enhance the mutual understanding of needs, values, and behaviors of the different stakeholders, help us to promote a sense of ownership of the interventions, and engage the stakeholders in a long-term commitment of changes and improvements. In summary, participation improves the quality of health systems and services. Two main questions guided this critical reflection. First, what are the challenges of applying a participatory mapping method to build a common ground for mutual understanding and negotiation between the different stakeholders in healthcare? And how can this challenge be mitigated? As this reflection is based in my whole PhD journey, I'm going to present you an overview of my research process. So I used the DRM methodology to structure my research. In the first part, I conducted a literature review to clarify my questions and plan my studies. And in the next 3 stages, I engaged with participants. Most of the time was through group sessions in workshops, but I also conducted some one-to-one sessions. My participants included patients living with chronic conditions and also healthcare senior managers and commissioners. Another important group of participants were design and human factors practitioners and researchers, and I engage with them and include them because they are the main facilitators of a participatory design process, and I want to hear their views. And throughout my research, I have a research diary that collected my thoughts in a more structured way. And I include some feedback survey and open question from participants also to help me to reflect of the participatory process. During my PhD, I developed this participatory outcome-based approach. And despite this paper presentation is not about how I conceptualized and developed the approach, I believe it is critical that you know 3 key characteristics of the approach. The first one is about system thinking. The approach aims to create awareness about the different interrelationships of the elements of the system, that we cannot understand the outcomes as the product of only one linear action, but rather they emerge from multiple elements, and thus we cannot keep working and try to improve the system by working in silos. The second point is about the holistic perspective of the approach, which emerged from acknowledging that all the stakeholders are equally important and play an interrelated role in the system. Therefore, we use outcomes as flexible elements to understand, explore, and collect the different needs and goals of the stakeholders. Outcomes help to build rapport as are often discussed, including values and meaningful experiences. Sometimes outcome-based discussions generate empathy and sometimes triggers tensions. However, all these add up to build a shared understanding. And finally, these approaches uses a lot of visuals to facilitate the sessions. The use of diagrams has helped participants to communicate more effectively and reveal unnoticed relationships and impacts of some of their actions. These are some examples of those visuals, which are the results of my research. I call them outcome-based system visualizations. And the last study was conducted online due to the lockdowns. So I invite you to check my previous publications to know the how and the why of the approach. Critical to my research was a research diary. In the beginning, it was open and unstructured. The aim was to capture the insights that were not collected in the diagrams or expressed by participants. Later on, I noticed how valuable those reflections were, so I created a structured diary to help me reflect on participants' behaviors and the experience of the participatory sessions. The second diary was completed as soon as possible after the sessions to collect the reality of the experiences as much as possible. These are the 5 challenges that we identified, and I will present each of them with their recommendations. The first challenge is the agenda and how difficult it is that all the stakeholders participate in the same activities at the same time, in the same place. Our recommendation is to explore asynchronous participation, which can bring together different voices. This type of participation should ensure all the stakeholders are exposed to different views continuously. Therefore, a reciprocal mechanism for feedback and response should be in place. The second challenge is collaborating in mixed and heterogeneous groups and how healthcare providers prefer to work in silos. Most of their reasons were to avoid discussing sensitive issues such as budget and commissioning with the patients. Their recommendation is to introduce the idea of a participatory sessions in homogeneous groups. However, it is essential that in these sessions you confront participants with other stakeholder views. This exposure to other views will trigger a willingness to respond and discuss with them. Then you, or sometimes they, propose to have a session with a diversity of stakeholders. Finally, participants felt confident that a discussion using the diagrams and outcomes will keep the focus on those topics, avoiding diverging to other sensitive areas. The next challenge is the evidence, as we relied on methods and materials not well known in healthcare. All the visual data and maps need to be combined with narratives and powerful phrases to be communicated effectively. We need to encourage that, especially healthcare providers, embrace different ways of reporting results. They react well to the map and recognize the richness of the data. However, we believe that these aspects need to be reinforced continuously, so they remember the benefits of trying and accepting data in different ways. The third recommendation affects the next challenge as well. It is key to have a champion of the approach and system thinking in the healthcare organization that eventually become the expert. They need to help us to communicate the results effectively with the rest of the team. In the long term, these champions will become a network of supporters that contribute to achieve mindsets about complexity in healthcare. They will help us to disseminate the importance of involving different stakeholders. Finally, another recommendation for facilitation is the use of boundary objects, which are artifacts that translate complex topics into more understandable ones. Most of the time, boundary objects are based on metaphors. We use some of them, such as outcome cards, outcome tokens, representation of patients and places, to encourage conversations about all those areas of the system. The last challenge refers to how to encourage conversation that explicitly discuss values. Values are not considered a practical issue and are constantly overlooked. However, it is critical to explore values to have a deep understanding of why someone supports and behaves in certain ways. The first recommendation is to use outcomes. You start with something more practical and from there introduce more in-depth questions to know why something is more meaningful and valuable. The second is to provide a respectful environment and language to express their values. For this purpose, I developed a value wheel with 28 values. We use this material to ask participants to express their values. We let them know that there were not positive or negative ones, but they are diverse. That key message encouraged them to conduct this exercise, but also knowing that all the participants will be sharing this information make this exercise more approachable. We shared the values in advance, including a description of each of them and some quotes to make them easier to understand. The values wheel was a pre-task to give them plenty of time to reflect on it. Now some conclusions. Tensions are a useful provocation to go beyond tokenistic participations and don't be cautious or try to avoid them. Especially if you are integrated a holistic perspective of outcomes, tensions and disagreements will emerge, which is an excellent way to build a shared understanding. Second, discussing values is critical for creating a long-term relationship of trust and mutual understanding because you share something personal and this is essential for a solid collaboration in teams. And finally, a positive remark is that I believe, and there is evidence, that genuine participation beyond those tokenistic activities is achievable in healthcare.
Thank you. Happy to answer any question that you may have.